77 WABC.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
1991, my father, who you know I adored, we just lost him a year and a half ago, we brought him to Dr. Lederman. You need to bring yourself or someone you know who needs to have the barnacles scraped off their backside to get their rear in gear and walk in there right now because Dr. Gil Lederman is New York's only triple board certified Harvard-trained radiation oncologist, first brought the non-invasive stereotactic body radiosurgery to America, and he's got the longest experience treating cancer using radiosurgery. So look, do yourself a favor. If it's cancer-related, and I'm talking breast, lung, pancreas, liver, kidney cancers, and more, you got to bring it to Dr. Gil Lederman. He'll send you an informative booklet DVD. You watch it first, you read, you sit down one-on-one with Doc Lederman, and then you prepare for what it is you want to do and you should be doing. Just call Dr. Gil Lederman at 212-CHOICES. Set up that appointment today, 212-CHOICES, or set it up for someone you know won't do it for themselves. At 212-CHOICES, that's 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. I hope you're fine and having a good week and everything is A-OK. We have lots of news, lots of cases to discuss. We're live and we're at the WABC studio. Bruce is running the studio. He's fantastic. He will answer the call and put it right through. So if you have questions, just call us at 800-848-9222, 800-848-9222. That's the studio phone number direct to us at the WABC studio. I want to talk about something that really is interesting to me and is news this week, and that is what happens to women who have unilateral breast cancer. They have breast cancer on one side, and for some reason they choose to have double mastectomy, to have both breasts removed. Now, it's shocking to me because for decades, doctors have worked on studies to randomly allocate treatment to keep the breast using radiation or to lose the breast with surgery. And we've always felt that by keeping the breast, one would have psychologically better results. We know that the medical results are equivalent or better. So why would a woman choose to lose both breasts? And we're not talking about a genetic condition here like Angelina Jolie, which is a very rare condition. We're talking about what happens to the typical woman with non-BRCA gene positive cancer in one breast, and she chooses to have both breasts removed. Is she doing that, or is her surgeon pushing her for that? Is that surgeon pushing her to do a bigger operation to make more money, or is it really better for the patient? Well, there's an article this week. It ran in AP, and it's actually run in a couple different periodicals about double mastectomy, and the title is, which simply states, double mastectomy does not boost survival. And Lindsay Tanner for the AP writes that removing both breasts to treat breast cancer on one side does not boost survival chance for most women compared with surgery that just removes the lump of cancer. And it's a large study. So it raises a lot of concerns why women are unnecessarily removing both breasts. It does not improve survival. And we know that physically, cosmetically, it is deforming. When I speak to women about it, they've never seen it, who've chosen it. In fact, many women who choose mastectomy and reconstruction have never seen what a so-called reconstructed breast looks like. Now, God does things better than many, and I think putting our body together originally is a work of art, and I think that surgeons who remove both breasts for unknown reasons, or for worse yet, no reason, are not doing women any favors. Now, this study looked at 200,000 California women treated for breast cancer on one side, and then followed years later, and 10 years later, there was no benefit for those women who had double mastectomies. And even women who had single mastectomies didn't do better. Actually, lumpectomy and radiation gave superior results. So you can treat the cancer, have equally good results, actually better results, and keep the breast. To me, it seems to be obvious what is the best treatment. Less surgery, keep the breast, keep the body intact. One of the doctors, a deputy medical officer of the American Cancer Society, said, "There's no guarantee by removing the second breast that you'll do better. In fact, you won't do better." So how would you ever do surgery to remove both breasts if you don't do better? It's a bigger operation, more to recover from, more to live the rest of your life not the way you were originally put together. But yet the women who are choosing double mastectomies has increased 12% between 1998 and 2011. There's a trend, especially among younger women, less than 40, to have double mastectomies for unknown reasons. The medical community is interested. Why are we doing this over-treatment? It's excessive costs. It's deforming. Why? Now, is it that the patient fears the cancer will come back and therefore doing more surgery psychologically plays into the woman's mind? But the data doesn't prove it. In fact, just the opposite. You have great results with lumpectomy and radiation. You keep the breast, keep your life, and you have the best survival rate. So for women who are having breast cancer or want to talk about this article, we invite you to come in. We have a private cancer treatment center in the heart of Manhattan, 38th and Broadway, and this is the work that we do. We look at the data and give you the data so you can make a decision based on facts, not based on fear. Because if you make decisions based on fear, like this study shows, you will not, it seems, get better results. In fact, I think it's worse results. Bigger surgery, more deforming, leads to no better outcome. So please, let's look at the data together. I invite you to come in if you have breast cancer or if you have a lump. A lot of women have lumps out there in the breast and they're just fearful to get worked up. Please, get the mammogram. Come on in. If you're fearful of pain or suffering, come in. Just this week, we had another woman who came in with a breast lump. She's been sitting at home in fear for years. You don't have to be that way. You can stick a little needle in. It's painless. You can know what the lump is. We can stage you up painlessly. You can know what you have and where it is, and then make a decision to keep your life and keep your body intact. And it's better to do it sooner rather than later. So please give us a call. Our office number is 212-CHOICES, because we believe you really do have choices. And like this study says, you don't have to feed into fear. You can keep your body together, most likely. Every case is different. Every person is different. But give yourself choices. Call us at 212-CHOICES, which is 212-246-4237, and we can talk about all your choices, all your options beforehand. Doesn't that make sense? And I want to talk about another woman, a young woman. She's about 42 with metastatic cholangiocarcinoma. Now, this is a woman, she's happily married, she has 8 children. One of her oldest child is in the U.S. military schools. She comes from Virginia to us for treatment. She's had treatment over the years to a variety of sites with radiosurgery. She's also had chemo. She's had other treatments. She just came in yesterday with her husband. They drove in from Virginia. Their water pump in their car broke, so it was a big scene, as you can imagine, if their car collapsed with 150,000 miles. But they made it in, got her staged up. We treated 3 sites in her lung. We treated them some time ago. She got her PET scan, and all 3 have been completely obliterated by non-invasive radiosurgery, 15-minute treatment in our office, which we pioneered for metastatic cholangiocarcinoma to the lung. A lot of people say, it's in the lung, you can't treat. Wrong. We've treated about 20,000 patients, and thousands of them are in the lung, and our success rate in the lung is very high. It's about 90%. Like in this woman, we hit 3 for 3. Pretty good. And we also, last year, treated a cancer in the spine and also in the lung. Those are gone, so that's 5 for 5. It's pretty good. Ted Williams, I think, had batted the best in baseball. He batted 400 one season. That's the best. That's 4 out of 10. In this woman, we are 5 for 5. So she has metastatic cholangiocarcinoma. She has several other new lesions which she wants us to treat. She likes our work. She's tolerated it well. She just brought her second child to Ohio to start school. We wish her well and her children well. And she has proof that radiosurgery works. And we like to give patients the proof. We don't like to hide things. So she has a copy of her PET scan, the pictures, the reports. She knows everything. And that's how we like to be, open and candid with the patient, so we can have good discussions and honest discussions and answer all the questions accurately and with all the time one needs. Well, another man who came in yesterday, 82-year-old man with rectal cancer. Now, he was treated at a big hospital in Manhattan 2 years ago. He had a biopsy and some kind of scraping in his rectum. Was not optimal treatment. 2 years later, the cancer, of course, is back because he had suboptimal treatment. And now, without complete staging elsewhere, he's getting radiation to a huge pelvic field from the ischial tuberosity, which is the bottom of the pelvis, all the way up to lumbar spine, and from the sacrum in the back all the way to the pubic symphysis in the front. So huge radiation fields, but he wasn't staged. Okay, they can say that most probably it encompasses that, but our philosophy is different. Our philosophy is, and our practice, not only do we philosophy means you think about it, but it also is a practice, how you actually practice medicine. Our practice is that we find the cancer, we hit the cancer, and we don't hit the healthy tissues. So in this man's, no one's done a complete staging, so they don't really know where the cancer is. He'd rather have just a few treatments with us than 6 weeks of treatment close to home. He's 82 years old. He wants to come to us. So what are we doing? Well, he came in yesterday. We arranged immediately a PET CT scan. He'll know exactly where the cancer is. We can hit the cancer and avoid healthy tissues. And that's what it's about. That's what we try to practice. Try to keep the body intact, hit the cancer, and have a better, safer quality of life. That's the work that we do in a nutshell.